So today I'm going to be performing a nasogastric insertion. I have gathered all of my supply and I'm going to be performing the procedure at bedside. I have walked to the patient's room, checked for signs of precaution. Patient is on standard precautions. Knock knock, may I come in? Come in. Provide some privacy. I'm going to wash my hands. Hi, my name is Vanessa. I'm going to be your nurse today. How are you doing today?
I'm okay.
You're okay. May I ask what your name is?
Tran Nguyen.
And your date of birth?
12747.
Any allergies?
Yes, I'm allergic to silk tape.
Okay, so I did see in the chart that you are allergic to silk tape, so I have an alternative for you too, okay? So I have checked in the order, and the order states that you have a nasogastric insertion to be placed regarding for gastric depression related to a suspected post-op paralytic ileus. Do you have any problems or concerns about this?
No.
Okay, so I'm okay to proceed? Okay, so I'm going to put the bed at Fowler's position. Okay, and then here I have my supply. I have a pen light, securement, lubricant, Medicup with pH strips, a tongue blade, some scissors, a Sharpie, an alternative that's not silk tape, a nasogastric tubing, irrigation tray that contains my syringe on it. And I have a basin and a clothes protector for my patient. I'm going to start off with putting the clothes protector on him. Okay. And this basin is for you just in case you need to, vomit. And then I'm going to wash my hands. I'm going to put some gloves on. And I'm going to set up my tubing here. I'm going to aspirate some air into my syringe. I'm going to remove this cap and attach it to my tubing and place it into my tray. And that goes into the trash. Okay, I am now going to check my patient's nasal passages. Can you tilt your head up? Okay, no redness, irritation, obstructions, or any trauma to the nostril. Okay, are you able to blow out of one nostril and then blow out of the other? I'm going to check her nostril again. And looks like the right nostril is much clearer than the left, so I'm going to insert the tubing through the right nostril. Next, I'm going to check the patient's gag reflex. Open your mouth. Okay. Put in the trash. Now I'm going to auscultate my patient's lungs. Move forward. Take a deep breath in, out. Okay. No wheezing, rhonchi, crackles heard. So then I am going to grab my tubing and I'm going to measure the length from the earlobe to the nostril, and then from the nostril to the xiphoid process on the sternum. Looks like it's 40. I'm going to then mark it, my permanent marker. And I'm going to extend another 20 to 30 centimeters. Okay. So here's your basin. Okay, and then here's some water. And I need you to tuck in your chin and sip some water when you feel the tubing in the back of your throat, okay? So I'm gonna put some lubrication into my tray. Going to lubricate my tubing. Okay, on the count of 3, 1, oh, can you lift your chin up so I can see? Okay, 1, 2, 3. Tuck your chin, sip some water. Okay. I'm going to check the patient's mouth. Can you open your mouth? Okay, the tubing is not coiled in her mouth, in his mouth. Okay. So now I'm going to secure the tube onto her nose. Feels okay? Okay. And then I'm going to auscultate her stomach. And I'm going to inject the air. Okay, bubbles were heard in the stomach, so that is placement number 1 to make sure that it did make it into the stomach. Now I'm going to aspirate about 20 milliliters of gastric juices. And I'm going to remove the syringe, make sure to put my finger to cover the tubing. And then I'm going to place my gastric juices into my med cup. And then I'm going to check the color, the appearance. And the normal range is, it is between 1.5 and 3.5. So that's good. And then I'm going to place my tubing set and connect it to my tubing suction. Okay, so I have confirmed 2 steps just to make sure that it's in the gastric stomach. So I'm going to, that it is in the stomach. The tubing made it in there. I'm going to remove this towel. And do you need the basin? No? Okay. Now I'm going to secure the tubing. Can you move your head up and down, side to side? Okay, I'm gonna give you an extra length here. Okay, so here's your coli. Do you need anything before I go? No? Okay, I'm gonna put the bed down, low position. And I'm going to collect all of my trash, and then going to remove my gloves, and then leave the room. And then I'm going to monitor the patient, document the procedure, how she tolerated it. And then I'll do that all in EHR tutor. And I'm also going to ask the doctor that the nasogastric tube is in place and to order an x-ray to check placement of the nasogastric tubing.